I would like to welcome you to Practical Tips for Giving Effective Feedback to Learners in an Academic Medical Setting training module. There are two main objectives for today's drive-through training. First, we would like you to be able to identify factors that make for good effective feedback to your learners, and two, we will highlight some barriers you tend to face when giving feedback. This module will address evaluation for graduate medical education as required by the ACGME. It will also incorporate the ACGME competencies, the first one being practice-based learning and improvement, and the second one, professionalism. Here are two quick definitions describing what is feedback. One, it can be seen as criticism that is given to someone to say what can be done to improve your performance, productivity, etc. Or two, it can be an informed, objective evaluation of performance intended to enhance clinical skills. Feedback is not just praise, such as, "You did an awesome job," or "You're great." These statements are too vague and leave the learner wondering, well, what was so awesome or great that I did? It is also not just encouragement. Things like, "Keep doing what you're doing and you'll be fine." The learner needs specific feedback on what to keep doing that is fine and how to improve on that skill. With that said, what are some barriers to giving effective feedback? Let's look at a couple of the more common barriers. First, the teacher or educator may not have a lot of confidence in their feedback skills, so they don't say a whole lot. Two, there could be blurred boundaries. Maybe the faculty member is too close of a friend to the resident. This might also be true with relationships between residents and medical students. Just remember to keep all feedback professional and not personal. Three, another possible barrier is the teacher who only exhibits one-way communication, meaning the teacher is doing all the talking and not allowing any input or response from the resident or medical student. Sometimes the learner is only getting feedback when things go wrong, when they should be receiving it when they are doing good as well. Lastly, barriers could simply be the teacher and learner's personality types. This is true when the learner is super shy, or there may be a generational gap between the faculty and learners. What is the goal of feedback? Feedback provides the learner with ways to improve their skills and correct their mistakes. It also allows them to build on their prior and accurate knowledge and be able to facilitate self-directed learning. Finally, it provides words in which the learner can really take the time to self-reflect, which is a critical and important piece of learning and improving skills. Romani and Krakow from Harvard Medical School in 2012 published 12 tips for giving feedback effectively in the clinical environment. It serves as a reminder and quick snapshot of things to remember and to practice. Let's take a look at their 12 tips. Number 1, establish a respectful learning environment. Number 2, communicate goals and objectives for feedback. Number 3, base feedback on direct observation. Number 4, make feedback timely and regular occurrence. Number 5, begin the session with the learner's self-assessment. Number 6, reinforce and correct observed behaviors. Number 7, use specific neutral language to focus on performance. Number 8, confirm the learner's understanding and facilitate acceptance. Number 9, conclude with an action plan. Number 10, reflect on your feedback skills. Number 11, create staff development opportunities. And finally, number 12, make feedback part of an institutional culture. As we near the conclusion of this drive-through module on effective feedback, here are a few reminders and practical takeaways. Do your best to build a department culture of providing feedback, and ask your learners for feedback about your precepting. For example, what can I do to be helpful to you? This is very powerful and things that they need to hear. Am I understanding you correctly? Is there anything else I am not thinking about? I will leave you with a great quote from Maya Angelou. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel.